I'm Johan Lambregts. I started my nursing career 43 years ago. I worked in several parts of healthcare, mental health care. One of my jobs was when the epidemic started of HIV here in Amsterdam. I was the first AIDS consulting nurse. And now I work for 30 years from an own agency, which I do advice and consulting in nursing and education. The talk will be about how nurses, of course, take influence to politics, and when we look to the world at this moment, then you can see that it's a very good topic chosen by the organization. Nurses are, of course, always active in their care and their daily work and are not so many times aware of, okay, how can we influence politics or policy? I made my scope a little more broader than only national politics, because I think there are a lot of other organizations like labor organizations, like the education world, which we should influence as nurses. So what I asked them is, what are their topics in cancer care which they want to be influenced to the politics or the policy, and then I give them some, let's say, advices how they could, what strategy they could use. That could be communication, lobby, and they can use their daily practice. Sometimes it's very good, or evidence, or research, and also what I give to them is that they really should make a plan with a structure. Which are my target groups? What's our strategy to reach our aims? Think political, be a member of a political party, be a member of a national nurses organization. And I think what's really important for the cancer nurses is to be aware that they are a part of a greater nursing community. And that's something what we did in Holland, I think, very well, because all the different groups, like, let's say, diabetes nurses, the community nurses, mental health nurses, are brought together in one national nurses organization, and that really helps. And I think we have more in common than we will differ. It's difficult, but I think nurses should more take the needs of patients as the departure point to work from. And when we really look to patient problems, let's take one thing like pain, or then you can see that a lot of patients with cancer have pain. But you can also see that patients with dementia have pain. So when you look from patients' perspectives, that's really important, and not only look to the nursing positions like what do we differ? No, what do we have in common, and how can we work together and cooperate to make the, let's say, the care better. When I look to the Netherlands, there's a lot of discussion about the right title used for the nurse, registered nurse, and then I think, yeah, it's so focused on ourselves and not on the patients. I think, by the way, that the cancer nurses, other nurses also, they work very hard. They are focused also, especially in the Netherlands, I see it really, they are real focused with evidence on their patients, and they're doing a good job. But I think, yeah, working together and cooperating, we can reach more. That would be my message for other nurses in other countries. I think it's a bit difficult question to answer for me, because I'm not really a nurse working in cancer care, but when I look to my topic, then I would say my advice would be, look good what you want to achieve as a group. What are your points? Is that education? Is that more influence in the hospitals on the care? And look, then make your strategy how you can achieve that. That's my thing, because I'm not a cancer nurse myself, so I can't really answer your question very well, but I think that's the thing, that they should be really aware what are the things we would like to achieve and what will be our strategy. But one thing is, what you really, if you ask me, this morning I had a little chat with a friend, and she is a person, she lives I think 20 years or longer with breast cancer. I said I was going to this conference and she wished me success. And I think patient advocacy is a real important thing for nurses. And I think most cancer nurses have that in their view. And I think also probably an open door, but a real good cooperation with medical doctors is very important for nurses to give the best care. I think when I look to nursing, then it's the exchange of information, the exchange of results of new research is really important to do, and it really gives inspiration, I guess, and that's an important thing for people who are all day hardworking. So reflection is, I think, a good word for them. That's something I hope nurses get here and achieve with those days. And when I look to the area and the location, it's real wonderful, I think, for many nurses to be here. There's one thing I want to state. I think that nurses really have a task and a big opportunity to get more money for their own research at the National Charity Organization from Cancer. I would wish that those organizations invest more and more in nursing research. And I really, in Holland and I think European-wide, the focus of those funds, which the public gives, is mostly too much focused on medical things. Important, but it would be wonderful to look to the job of nurses, to look to the workload of nurses, how we can support nurses better with evidence. And this is really a chance for those funds, in my opinion.